Good afternoon, dear students. Today we discuss in about Entamoeba. Entamoeba comes under phylum Protozoa, subphylum Sarcomastigophora, class Archamoeba, family Entamoebidae, genus Entamoeba. Entamoeba have been divided into four groups on the basis of trophozoites and cystic morphology. First group Histolytica, second coli bovine group and gingivalis group. Species Entamoeba histolytica is the more important and pathogenic species affecting mammal, particularly men. Morphology of Entamoeba histolytica: two stages, trophozoite stage and cystic stage. The trophozoites are irregular in shape and measure 10 to 60 micrometer in diameter. Cytoplasm can be differentiated into hyaline ectoplasm and inner granular endoplasm. Locomotion is by means of lobopodium, which is formed by ectoplasm and endoplasm. These are finger-like projections used for movement. Now, endoplasm contains food vacuoles in which RBCs, tissue fragments, and leukocytes are absorbed. There is a single nucleus shaped spherical 4 to 6 micrometer in diameter. The nucleus contains a small endosome in the center and fine chromatin granules arranged along the periphery. Strands of chromatin materials run from periphery of nucleus towards the endosome, giving a characteristic cartwheel shape appearance to the nucleus. Now, cystic stage. The cyst is 7 to 20 micrometer in diameter, spherical in shape. Cyst wall colorless and transparent. In a fully developed cyst, there are four nucleus, each with a centrally placed endosome. Chromatin rods may also be seen in some cyst. What is cyst? The cyst trophozoites discharge undigested foods and condense into a spherical mass is called a cyst. Survivability of cyst can be survival for several days at 4 to 8 degrees centigrade. These are sensitive to putrefaction, desiccation, and temperatures above 40 degrees centigrade or below -5 degrees centigrade. Chlorination of water does not kill the cyst, but 5% acetic acid kill them into a few minutes. How can differentiate cyst and trophozoite stage? Cysts typically found in formed stool, whereas trophozoites are typically found in a direct stools. Now, transmission. Mainly, trophozoites are multiplied by binary fissions and transmitted infection through food and water contaminated with cyst and trophozoites. Other way, like eating up raw and uncleaned vegetable, also cause infection. Lack of personal hygiene, use of water polluted by night soil, contamination of food by flies, handling of food and water by contaminated hands, and are other common mode of transmission. Now, life cycle. Entamoeba histolytica: cyst ingested by fecal contaminated foods or water, and the cyst existence occur in small intestine in an alkaline environment. Metacystic amoebas divided and more down into larger intestine. After existation, trophozoites multiply by binary fission and divided into trophozoite stage and cystic stage. Now, pathogenesis. Pathogenesis of Entamoeba histolytica mainly severely affected in to the males. Disease may be acute or subacute but chronic infections are most common. The parasite penetrate the intestinal wall by lysis of epithelium and multiply in the epithelium, forming small colonies and then penetrate into the submucosa. They invade deep into the mucous membrane and produce an inverted flask-shaped ulcer is the pathognomic lesion of Entamoeba histolytica, having a narrow canal or neck opening into bowel lumen. Now, clinical symptoms in acute amoebiasis dysentery, the feces consist almost blood and mucus. There is a severe abdominal pain with straining. In chronic amoebiasis, recurring symptoms may continue for a long time and there is occasional abdominal pain, nausea, irregular bowels, headache and fatigue. All these symptoms stimulate for appendicitis and peptic ulceration. Prolapse of rectum due to rectal staining. Other affected animals or non-human primates suffer from this clinical condition. Example, pigs show similar symptoms like human beings. Dog may suffer from acute or chronic amoebiasis. Kittens may show acute dysentery with extensive intestinal ulceration. Now, diagnosis by gross or microscopic examination of fresh discharge feces, history, clinical symptoms, radiography and other serological test and skin test. Now treatment, mainly amoebiasis drugs. Metronidazole is the drug of choice. It's 5 milligram dose is given orally thrice daily for 5 to 10 days. It is in fact effect against amoebiasis. Drug like tinidazole is considered most effective. Now control, amoebiasis can be controlled by adoption of proper sanitation, personal hygiene, supply of clean drinking water, proper disposal of sewage and noise solving. Prevention of fecal contamination of food by flies, cockroaches and other evidence of overcrowding disease. Thank you.